Well, hey guys, what's up? So I'm filming two videos for you all this week back to back. I just filmed a all about BHA video. So when that goes live this week, if it hasn't already, make sure you check it out. Talk about salicylic acid in that video. It's a follow-up to my alpha hydroxy acid video, addressing all of your questions about BHA and salicylic acid. In today's video, you guys have seen me go into CVS a fair amount and review the skincare products in CVS. I have one in my neighborhood, so it's pretty easy for me to dart in there. And to be honest with you, their stock of supplies waxes and wanes, and they don't always stock particularly well, at least at that one CVS that I go to. But one line that they carry in there is a brand called MD Complete, and I talked about it at one point when I went in there. They have some anti-aging products that I mentioned in that video, and you guys really liked it and you commented on it. I got a lot of feedback from that video. And so MD Complete actually reached out to me and asked me, I guess after seeing that video, they asked me if I would look into and review their acne clearing system. They have a 4-step acne clearing system. Here, I just lost this little bottle here. So they asked me to review it for you guys, since I don't think that all of those products were in CVS that day. And so since I'm reviewing, BHA and AHA for you guys, I thought now would be a good time to review this line. There are many acne multi-step systems out there. There's Proactive, there's La Roche-Posay has their Effaclar series or 3-part acne system. It's not uncommon, and I actually like that approach because you all watch my videos. We talk about the ingredients together, so your lexicon, hopefully, in watching my videos as to what the active ingredients in acne products are. I hope that it's helpful in expanding that and making you more knowledgeable about the ingredients. But what I like about having these 3-part skincare systems like Proactive or La Roche-Posay or this MD Complete is that it's a logical pairing of active acne ingredients that a dermatologist would recommend to you. And in logical forms like salicylic acid face washes and benzoyl peroxide spot treatments. And sometimes they add in a toner that has, maybe a retinol in it for people who can't get tretinoin or can't get differin. So I think they're really smart and a really smart way to package things, and a lot of patients do really well with them. And it takes the guesswork out for them. They don't have to go digging around trying to find these ingredients and troubleshooting them. It takes the guesswork out, and so patients actually do really well with these acne 3-4-step systems that you can get. You can get them at the drugstore. And MD Complete is a line created by Dr. Brian Zellickson. He is a Mayo-trained dermatologist. All of his products are cruelty-free. And so that was another reason why I wanted to review. I was happy to review this for you all. A lot of you guys asked me to review more cruelty-free products. A lot of the stuff that I recommend is not cruelty-free, particularly in the line of acne. So step number 1 here he's got a 4-part system. Step number 1 is basically a 2% salicylic acid face wash, which is, I use one every day. They're great. Salicylic acid in wash forms concentrates in the oily surfaces of our skin quite quickly, can give long-lasting acne relief with just the short contact time in a wash form. It does not need to be a Levon product, okay? And he's got one here. I think it's about $14 for this face wash I saw at CVS for the 3 ounces. So, it's not extremely expensive. And here it is in the bottle. Again, it is cruelty free, and it's in using it, I feel as though it's pretty similar actually to the Neutrogena oil-free acne wash. It's very similar. With the exception that this is cruelty-free. So if you're somebody who used that for many years and you're looking to switch to exclusively cruelty-free products, you might consider this one. Like the Neutrogena acne, oil-free acne face wash. This also has fragrance, however, so that's a shortcoming of this product, is that it has fragrance in it. For people who are, you know, allergic to fragrance, fragrance allergy can develop at any time. Sometimes when your skin is inflamed and irritated, is more susceptible to developing fragrance allergy. So I prefer products that are fragrance free, but you know, they're fragrance is frequently added to things. This also has methyl isothiazolinone, which is a preservative that is more than fine, but a lot of people can occasionally develop an allergy to it. So if you have an allergy to that, or you have an allergy to fragrance, then this might be problematic to you. But otherwise, it's a very good face wash for acne-prone skin. You could also use this on acne-prone areas on the body. It can be used twice a day. Do not use this, however, as a quote, as a cleanser. Don't think of it as a cleanser to your face and trying to wash your entire face with it, however, because you want to be careful to avoid your eyes with something like this and avoid your neck. Okay, those are areas of the body where the skin is really, really thin, and you can develop a lot of irritation with this product in those areas. So just target it, you know, in acne-prone areas only, like the nose, the forehead, the jaw area, the cheeks, but just be careful around the eyes, and you know, you'll do fine with this. Make sure you use a moisturizer after you rinse this off. But it's otherwise great. You know, it's pretty similar to the Neutrogena oil-free acne wash that I've used before. Next up in the 4-part system is a benzoyl peroxide Levon product. This is like a spot treatment. And benzoyl peroxide is another fantastic ingredient in acne skincare. It's fantastic for a variety of reasons. It's anti-inflammatory, it's antimicrobial, okay? And one of the great things about benzoyl peroxide, particularly for people with acne, is that a lot of times if you're seeing a dermatologist for acne, they may have prescribed you a medication that has an antibiotic in it, like a topical antibiotic, like a topical clindamycin wash, a topical clindamycin lotion. And those antibiotics are great for acne, they're helpful for acne, they're oftentimes necessary for acne. But there is a risk with using antibiotics, topical antibiotics. I'm only talking about topical antibiotics here. There is a risk that the bacteria on your skin can develop resistance to those. Benzoyl peroxide lowers the chances that will occur if you use those. And bacteria on your skin, while this is antibacterial in and of itself, the bacteria on your skin cannot develop resistance to this ingredient. So it is fantastic. It gives you antibacterial control. There's a little bacteria in our skin that contributes to acne called P. acnes or Propionibacterium acnes. And this helps keep him in check, and it is great. Benzoyl peroxide in a wash and leave-on form can be really, really helpful. Really, really helpful as a spot treatment and clearing it up. Again, like the face wash, this does have fragrance in it, so that would not have been my choice, but some other ingredients besides the benzoyl peroxide that are helpful in this are allantoin. I talked about allantoin in my skincare ingredients video. It is anti-inflammatory and moisturizing. So it's a really good ingredient to put in a benzoyl peroxide based product. This can be used as a spot treatment twice a day to acne spots on the face or on the body. Do know that it is very drying, and so you know, make sure you're using a moisturizer along with it. This, as well as a face wash, are both going to be drying, so you know, you really need some really good moisturizers with these. And then the other thing that you should know about this, along with the face wash, is that they're going to increase your risk of developing a burn more readily, and so you really, really need to wear sunscreen with these as well. The last thing that you should know, if you're not already aware, and you'll read this, if you read the Amazon reviews, you'll read some negative reviews, and this is why. Benzoyl peroxide, if you're not aware, will bleach your fabrics, okay? It's not like it's bleach, but it will bleach your fabrics, okay? So when you use these products, when you use this, make sure that the skin is completely dry, and that this is completely dry before you go putting on your good shirt, okay? And one little tip when you use a product like this, if you use it at nighttime, is to take some old, take an old t-shirt and lay it on your pillow. That way you don't get it on your pillowcases and stain the pillowcase. But yes, this will bleach your fabrics, and there is a negative review on Amazon that I saw where somebody's like, there's bleach in there, it's bleaching our fabrics. Yeah, it's the benzoyl peroxide. Benzoyl peroxide does that, but it's also a great ingredient for acne. So not great for your linens, but just take those precautions to avoid that. So that is step number 2. Step number 3 incorporates a cosmeceutical retinol. I talked all about cosmeceutical retinols in a recent Q&A. I've talked at length about tretinoin for acne. I've talked at length in separate videos about adapalene, which is another retinoid for acne. And in my last retinol Q&A, I also talked a little bit about tazarotene and Tazorac. Okay, those are all vitamin A derivatives. And so the third step here is a retinol, and there's also some, citrus extracts and citrus fruits in here, which theoretically can, help kind of brighten the skin, inhibit some of the biology of pigment cell production, but they can also be irritating. Okay, so of all of these steps, I would say that this is the one that has the potential, I think, to be most irritating and problematic and sting. But as far as the retinol in this and using this as a retinol, for those of you who can't get tretinoin or differin, this is an option, and you just want to use it twice a day to acne-prone areas on the face. You can also use it on the body as well. Do know that, like the other products, it does have some fragrancy ingredients that could be irritating to you, however. And then the last product I'm actually pretty excited about. I haven't seen this in any acne skincare lineup, and I think it's really a logical and smart thing to include. There is it's this healthy skin probiotic. So everybody always asks me all about what supplements should we be taking, what things should we be taking for skin health, for hair, skin, and it's kind of a gray zone, okay? But there has been a lot of interest in dermatology in recent years in probiotics and in skincare. Most of the research is in a condition called atopic dermatitis or eczema. For taking probiotics, for putting probiotics on the skin, it's really an area of active research, okay? There's a lot of research interest in the skin-gut connection and how our gut microflora and our skin microflora influence the inflammatory milieu in our skin and set us up for inflammatory skin diseases like eczema or atopic dermatitis and like acne, okay? But we've also got some evidence that people with inflammatory lesions of acne who take a probiotic supplement have better rates of clearance and better overall improvement in their acne in comparison to those who don't when on standard acne treatments. Okay, so it seems like probiotics can really be helpful for people with acne. We have some good evidence that people with acne have an altered gut microflora and skin microflora that's thought to set them up for some of their acne developing. And I mentioned already P. acnes as being playing a role in driving acne pathogenesis and acne as a disease. There are other bacteria that live on our skin and are supposed to be there, and those bacteria kind of help keep him in check. And for whatever reason, people with acne, sometimes some of those other bacteria can be potentially a little less abundant, it seems. And so taking an oral probiotic seems to help theoretically in kind of restoring some of that balance. And then lastly, the other reason why probiotics are great in people with acne is that a lot of the times people with acne are prescribed an oral antibiotic. I mentioned already topical antibiotics, but additionally people with acne frequently are prescribed an oral antibiotic to get good control of their acne. It is standard of care, a standard of care treatment. It works very well and is very, very helpful in protecting the individual from developing scarring lesions, and oftentimes is needed to kind of get that acute acne control. But it does come with a risk, particularly with long-term use of the bacteria in our gut developing resistance. It does alter our gut microflora. And it does put you at risk for a condition of bacterial overgrowth, a bad bacterial overgrowth in the gut called Clostridium difficile, or C. diff, okay? For people who are on antibiotics long term, taking an oral probiotic is often recommended just to kind of help combat some of that. So it's actually a very logical supplement for somebody with acne to consider. And the other reason it's a logical supplement to consider taking is that it seems to be incredibly safe, okay? Probiotics seem to be incredibly safe. The other reason that Dr. Z's probiotic is pretty cool is that Dr. Z put in niacinamide. I talked about niacinamide. I talked about it in topical products before. I have a whole video on it. But people who take niacinamide or nicotinamide, it has been shown that that has a profound anti-inflammatory effects for the skin, that it can be helpful for acne, and that it also can help people who are predisposed to developing pre-skin cancers and skin cancers make fewer of those. So it seems to be another ingredient worth taking. Do know that it potentially can interact with some medications. So Dr. Z has put it in this, which is a great ingredient, but do talk to your treating healthcare provider before taking a supplement like this to make sure that it's okay for you, given any other medications that you may be on or any other medical conditions that you may have, wherein it could potentially be a contraindication to something like this. But overall, this is very, very safe and a logical step. Number 4. So I think this is one of my favorites in his lineup. All of these products, though, they can be very irritating. So my recommendation to you, as far as the stuff that in the lineup that you would put on your skin, what I would consider doing is just use one for a few weeks before adding in the second step, before adding in the third step, to give your skin some time to get introduced to the ingredients. Do you know that these active ingredients themselves, they can take several weeks to begin to have maximum control of your acne, but they can begin helping pretty quickly. But usually, 4 to 6 weeks of continuous use before you really start seeing improvement. As far as the oral probiotic supplement, this can be taken daily, ideally, I guess, for maximum effects, but it's a little on the pricey side, and that may be cost prohibitive to you. One way that Dr. Z recommends it, and what is logical, is to take it before a stressful event. We know that stress triggers acne, and we also know that stress can impair and influence our gut microflora. So I think that is a really, really rational way to use this. If you're somebody whose acne flares around stress or stressful periods, it might be a time to consider introducing this into the lineup. But yeah, that's my review of the MD Complete, their acne system. I also have some sunscreen to review for you guys from MD Complete, and a bright spot corrector with hydroquinone that you all had asked me to review some hydroquinone based products for brightening dark spots and melasma. So I'll be reviewing that for you as well. So stay tuned for those. But if you like this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe.